colleagues. Today I'm going to present Aptos methods. I'm Dr. Renata Roxo from Rio de Janeiro, Brazil, and the Excellence Visage threads that I'm going to show today have already Anvisa and FDA. I'm going to show my patient today. She's 49-year-old and she wants facial rejuvenation, and she's a personal trainer, so she goes to the sun every day and she loses a lot of volume here, and that bothers her. She wants facial rejuvenation. She has some wrinkles and some laxity. So with Excellence Visage, it's good to remove, to do a lift and place some volume here. When we put the threads here in this cheekbone area a little bit deeper, we can improve her and give her a more beautiful skin and a rejuvenation. And I'm going to show the thread I choose for her. Aptos Visage Excellence have three sizes of thread, so I choose this one. That's the Excellence Visage Soft. This is a box complete with 10 pre-filled cannulas with the thread inside, the pre-filled cannula, and also come with needle to do the entry point and a cannula to do the anesthesia. And this thread is made of a copolymer of PLA, PCL, so it's polylactic acid and polycaprolactone. Perform the procedure with local anesthesia, and I'm going to use lidocaine with epinephrine, and I'm going to dilute with saline solution 1:1 because this lidocaine is 2%. And I'm going to show the vectors I'm going to choose for her. I'm going to do a line that begins in the lateral contours of the eye until the hairline. So my entry point will be before the hairline. Also, I'm going to show where I can't insert my threads. So I can't insert my threads between this area and the lower eyelid because the skin is too thin and the thread can be shown. And I'm going to draw another line. That's my lateral border. That usually it's in front of masseter and close to my problem of the jaw. That's the area she wants to improve, to get better. So I'm going to place my 5 threads here inside this area. This one I'm going to do beginning the entry point to the jaw compartment. The other one I'm going to do to the jaw, and then to the angle of the mouth. And these 2 other threads I'm going to do like a loop here, so I can lift and give her a little volume here. That's what she wants. So I'm going to do the same in the opposite side. A line in the contour of the eye until the hairline. It will be my entry point before the hairline, the area that I can't go with threads, my lateral border, and my threads that will be parallel, and here a loop to collect volume. It's important to stay close to the patient to insert threads, so I put the patient in the position it's better to work for me. She's not too far, she's not too high, so I'm going to work with my fingers. So now I'm going to wash my hands to clean myself, then we are going to start the procedure. It's important to wash our hands because all the procedure must be clean to avoid infection. And also I'm going to wear sterile gloves. all the time we must be clean without touching anything, but when we clean our hands and put our sterile gloves, we can touch the cannula and we can touch the thread. So I will use my instruments sterile. I'm going to use sterile gloves, the 3cc syringe, and here I can show the Aptos Excellence Visage Soft. So I'm going to clean my patient with polyvidone iodine 10%, which is similar than betadine used in other countries, which is non-alcoholic, no smell, and it's good because we can see the color, so we can see what are we cleaning. It's important to clean all the patient. I'm going to put the local anesthesia, the entry point with lidocaine and epinephrine. So I did the local anesthesia with the 3G needle. The entry point with the 18G needle that comes in the package. I can do this entry point in 45 degrees. Now I will infiltrate the tissue. Each line I'm going to do the threads, to insert the threads, and in the superficial layer, we have to put small drops, very small drops. It's enough to put 1.5 cc each side to get good anesthesia. So we are going each line. I'm sliding down the cannula. It's very comfortable. Okay, Dani? Mm-hmm. So the patients feel comfortable. I'm going to show what I'm doing, like small drops, like this. So if you do this, it's enough for anesthesia. For this procedure, it will be very comfortable for her. Now I'm going to infiltrate the opposite side. Again, my entry point with the 18G that comes in the package and the 23 gauge cannula to do local anesthesia, subcutaneous fat, parallel line, small drops. That's what I'm doing to get the patient comfortable. Always it's good to put small drops because we can avoid swelling. And it's good to wait a little bit so the epinephrine can works, giving less hematoma and less edema post-procedure. So I did 1.5 cc each side. So I'm going to insert the S-Lens Visage Soft, which is 10 centimeter long thread. It's preloaded, the thread. Here we can see the round tip cannula. And I will start from lower part of the face, from entry point to marionette, and always in the soft tissue layer. So I'm going to insert my first thread. I check my plan. Okay, I'm the superficial layer. When I achieve, I can feel it. I lift all my tissue. I go back with the cannula, but not until go out. And when I'm here, I'm going to encore. Now I'm going to the marionette line. It's important not to cross this line. I don't cross the marionette. I go back, lift tissue, and then when I'm here, I will encore thread. The third thread, I will go in the angle of the mouth. Lift tissue. I'll go back and encore thread again. Now I'm going to the cheekbone area where I want to put her some volume. So I'm going the superficial layer. When I come here, I'm going to collect more tissue to give her a volume. But I need to be in the superficial layer, but a little deeper. Above is mass. And I'm going to do like a loop. I'm going to collect tissue, and when I'm here, I collect. Back. It's important to put your hand close to the cannula, to the tip of the cannula. So I'm going to do again the first thread to the jaw compartment. Always I have to check if there is any hair. You can place hair inside. Lift tissue again. And encore. The second thread I'm going to put in the marionette line. Superficial layer, always. The procedure is very comfortable. My third thread, I'm going to the angle of the mouth. The fourth thread, I'm going to the cheekbone area, doing a loop to lift and to give her some volume. And I'm here, I turn, I collect tissue and I go a little bit deeper, but still in the subcutaneous fat. I'm going to do another loop, collecting some tissue. So I'm going to show the result. She got some volume here, she got some lift as she wants, and no bruising, small swelling, and she's going to improve her skin in the days. And the procedure was very comfortable, right? And I'm going to give her some recommendations. As she's very active, it's better for you not to drink anything hot like coffee or soup for some days. And also don't go to sauna, please, and hot tubs. Yes, and avoid running on the beach. I know you like running, but if it's possible, try to not run for 15 days. And it's good to sleep with your head up. Don't go to sleep like this. And also don't massage your face. Don't wash for 2 days. Avoid applying anything in your face for 2 days. Also, I put here some micropore stereo that I did in autoclave. So take this off about 2 days, don't touch.